Thank you so much for tuning in to this episode of The Kim Jacobs Show. Be sure to subscribe to The Kim Jacobs Show right on YouTube. Turn on your notification bell to all so you never miss a beat. And guess what? Every time you watch, you're going to receive a real relevant and relatable guest that's going to share with you a piece of the puzzle on this journey called life that will help you be able to manage just a little bit smoother. At the end of the day, the Kim Jacobs Show goal is to be able to provide balance to the world, one household at a time.
Kim Jacobs Show. You're watching Kim Jacobs Show.
Hello, everyone, and welcome to this episode of The Kim Jacobs Show. How are you, Dr. Ron Kennedy Bailey over there?
Wonderful. Good morning to you.
Glad to have you here today. And listen, everyone, as you're grabbing your virtual seats, go ahead and share the broadcast. Time you sit down, share the broadcast. Sit down, share the broadcast, because we want people to hear today's topic on how COVID has impacted the mental health, and especially men. We're going to be talking today heavily with it being Men's Health Awareness Month. We're going to be really focusing on men, and Dr. Ron Bailey is here to be able to talk from that perspective. And I am pronouncing your first name correct, right?
That's correct, Ron.
Okay, so Dr. Ron Bailey is going to be here to just share his thoughts and his medical insight. So we don't want anyone to miss today's episode. Dr. Ron, where are you located, Dr. Bailey?
I'm in the great city and state of New Orleans, Louisiana today.
Okay. So no wonder you already sound like you're in that, hey, I'm in a great city.
It's a great place.
It's like it's a festive environment, right?
I've lived here for a year. I'm born and raised in Texas. And I've read of any place that I've enjoyed more than this location. The people here are festive, live life to the fullest. I think enjoy much about what's good about life. And I'm happy to have joined, become a new Lagniappe-oriented New Orleanian.
Oh, that's interesting. And the funny thing is, I know when I visited New Orleans, I think I walked down the street a little differently. I was like, I had a little skip in my pep in my step, and I just felt like I was going somewhere. I don't know what that's about, but there's a change when you're in New Orleans.
Well, the good food could have a lot to do with it. I've thought I've had good food throughout my whole life and been very fortunate. My mother was a good cook and all that kind of business, but I've rarely had food regularly as good and tasty consistently as here in New Orleans. So it comes as good as advertised.
Well, I don't know what your weight was before, but have you picked up any pounds at all since you've been there?
I'm trying my best. It's tough, I'll tell you. Hard to not gain weight here.
Well, listen, everybody, even though that's not the topic for today, New Orleans and the great food and the fun, festive environment, we're talking today literally about COVID and how the impact of COVID is on our mental health, whether you're men or women. But I want to make sure that you know in the United States, there has been about 80 million cases of COVID and 1 million deaths since 2020. And make sure you let me know too, Mackenzie. Oh, this is according to Harvard, is where I think you got those statistics. Thank you so much. Mackenzie's working backstage and sharing these statistics. And at least 65,000 more men than women have died with COVID. So these are staggering numbers. And today, Dr. Bailey, I'll give a formal introduction right after this commercial break, but we're going to deep dive on this topic of COVID's impact on mental health. We'll be right back after this commercial break with a formal introduction.
I'm attorney Kenneth D. Snow, and at the Snow Legal Group, justice is our job.
For more than 20 years, Attorney Snow has been fighting for justice and winning cases in the Carolinas by providing aggressive representation in criminal defense, domestic violence, family law, serious injury, and wrongful death. If you've been injured or lost a loved one in an accident, including tractor trailer or rideshare, you need the Snow Legal Group by your side, fighting for justice and fighting for you. Visit snowlegal.com. Call 704-358-0026 for a free virtual consultation. Located at 6827 Fairview Road, Suite D in South Park.
All right, everyone. And we are back. We're talking with Dr. Ron Kennedy Bailey. And today, as I introduce him, I want us to take notes. Feel free to ask questions. And as some of you did yesterday, I will put the link in the comment section. If you want to come on and ask a direct question on screen, I'll make sure you get an opportunity to do that. All right. So Dr. Ron Kennedy Bailey is the board chairman of the Cobb Institute and chairman of psychiatry at LSU Health, New Orleans School of Medicine. He has served as president and a member of the board of trustees of the National Medical Association, which represents 40,000 African American physicians in the United States. A nationally known clinician specializing in inpatient care, medical education, research, and forensic evaluations. Dr. Bailey has extensive experience creating and overseeing community-based programs, as well as focusing on care for the traditionally underserved and patients with complex medical, psychiatric, comorbid diagnoses and conditions. Welcome, Dr. Ron Kennedy Bailey, to the Kim Jacobs Show.
Thanks for having me, Ms. Jacobs. Happy to be here.
I'm glad to have you today. And thank you, Nefertira. I think you're behind helping us get Dr. Bailey here today. So thank you as well, and your PR agency. So let's start and jump right into today's topic. How do you feel that the pandemic with COVID itself coming out of nowhere, literally, has impacted men's health in particular?
It's a great topic. I think you're 100% right. Issues we must think about and deal with to decrease the morbidity of disease, I think, in our community, especially the Black community, and certainly try to modify these early, unnecessary, and unwarranted deaths of persons very often who may need an information-oriented program for their own safety and security. I think that COVID-19 has done three things. One, first and foremost, we all have had the flu and a cold or a virus.
Right.
We began to kind of take it for granted. The reality is these viral risk can be substantial and can actually lead, unfortunately, to very severe death. Early on, we talked a lot about a person being on a ventilator, being hospitalized, and few of us now are without some relative. My own uncle, for example, who've actually died due to COVID. So I think the seriousness, I think, has kind of caught our attention. Secondly, I think that we have kind of dropped our guard as Americans, and even in my community, of realizing and being active participants in our own health and safety. The entire discussion about whether we should wear a mask or not is so disingenuous to me. As a doctor, we spend a remarkable amount of time discussing with people all the things that you should do to protect yourself. You wear a helmet when you ride a motorcycle and a seatbelt on a car, and we do all kinds of things to limit our risk. You wear coats and heavy clothes when you go out in cold weather. People don't generally fight about whether they should do it or not. They know themselves if they don't do it, they're going to be at a higher risk. But to fight and try to ask people at the government level not to require you to wear a mask is very different than what we've been, I think, for the entirety of my now 32-year medical career. And the final part I simply argue is that this idea that we might infect others has been striking to me. One would have always thought that the risk to others generally causes persons, even who may take more risk on their own self, to be more cautious and more conservative and more beholden to the recommendations from authorities, to be in somewhat consideration of not caring about infecting others, especially older persons, for example, in your own home. That's been a bit of a surprise. So those three issues, I think, have been remarkably important to me, and the messages we try to share, I think, with patients, family, and colleagues.
That's interesting. So it is of your opinion, or from a medical perspective opinion, that people still should be wearing masks regardless?
I was at a meeting on yesterday. It was a meeting of all physicians in my hospital. I'm in the university hospital, the main teaching hospital in the university, and the primary COVID doctor in LSU's teaching hospital was double masked in a meeting with about 50 doctors in the room. We were interviewing for a new CEO. When the person alive in the city who knows the most about COVID is still double masking, it'd be ridiculous for, I think, anybody else to argue that we shouldn't wear masks. Government can say you don't have to wear a mask. It's not illegal if you don't. We won't sanction you or penalize you. You won't lose your job. But if you ask somebody from a health perspective, is wearing a mask safer in this time and age? The answer is absolutely yes, as we noted with several doctors yesterday, but especially our COVID specialist.
Interesting. Okay. Yeah, I see your comment. The views expressed are the views of me or my guests. They're not always reflective that of the show. But anyway, I think that is very educational for me too. I can only, again, speak personally. This is not just representing the Kim Jacobs Show, but as a person, I know that I personally slacked up some now that I've seen everybody kind of going back without masks. I was thinking personally that okay, so maybe from a medical perspective, it's okay if we keep some distance and I'm not right up on people and I have 5 to 6 feet of kind of space between me and
Right.
someone else. But what I'm hearing you say today, this puts me in a different mindset, which means I'm going to be yanking my mask back out.
Well, I thank you for the time because it's a lot to say, but I'll just briefly say there are a lot of reasons why wearing a mask can be helpful. But you're 100% right. One doesn't have to wear a mask. It's not the CDC guidelines. You only put in gym, you wear a mask, etc. But if I'm in an environment with other persons, there may be more risk than if I'm by myself. If I'm with other persons who may or may not be vaccinated, let alone boosted, I may be at a higher risk. And other persons who may actually have a history of chronic illness where their immune system is weaker and they may have a higher likelihood of passing on a virus such as this, I may even have higher risk. For all those reasons, very often issues that one won't necessarily know. When you walk into a store or a mall or the case may be, wearing a mask can certainly be helpful.
That's
But
good.
again, I'd argue that these are issues that I think I'm making a point that we should know, or whether a person chooses to do it or not, is what I think has changed in our community.
That's good. That's really good way to put it in perspective. And Dr. Bailey, I know that so many men are passing of COVID as well. I mean, many of us have females that are within our own families and friend circle that we can name as well. But I'm wondering why more men are passing at a higher rate than the women. Any insight on that?
Right, well, we certainly think, and it is unfortunate, it's about 1.6 times or more men than women, almost double. Clearly, men have what we have historically argued are more so-called forward-facing jobs in transportation. If you're driving a bus, for example, jobs where you work outside or you're around other men in significant groups. More women have historically worked in certain settings where they may be more alone or in an office or in a closed setting away from a lot of other people. Men also, I think the studies show, don't wear masks as often. We're a bit more recalcitrant to wearing
Okay.
masks, even when masks were required, if you will. I think it's also true that more men are in these large congregated settings, in a prison or homeless, in settings where you're on many other persons who may have a less than optimal health care. So collectively, there are a variety of reasons why we think men in general may be at more risk or have been at more risk during these 2 years of the pandemic.
Interesting. So when it comes to men, because you are a man too, so you can probably chime in on some of the, are there any kind of behavioral type of differences that you observe with men versus women? And I know you can only speak from your perspective or maybe even some of the patients that you've served, but just give us some insight on that too.
Well, I do think that the idea that I'm young and big and strong, an issue that I think all persons who are male, and you're right, as a male, I must admit there's certain time in my life when I parlayed in that certain type mindset as well, may give some a false sense of bravado or
Okay.
encouragement or a thought that they might not need to be at risk the way others may be. Football, for example, is a sport that promotes that you're younger and bigger and stronger. When it's raining outside, you don't stop the game. You keep playing, for example. So this idea that I think there may be some additional variables that may affect men in general. I think especially younger men may put them at a higher risk. Is not wearing a mask may be one issue, but it's also this idea that perhaps you don't take into account keeping your 6 foot social distancing and trying to limit the amount of time you're around others. There are a variety of individual choices that persons make that may put them, that may limit their risk and enhance safety. As a physician, we simply make the argument, education matters. People should know what the risks are, and we encourage them to follow a very pro-safety oriented process.
That's really good. Really good. Okay, so I see quite a few comments that's coming into the virtual studio audience. What I'm going to do is we're going to take just a quick commercial break. Let me put this link here for you. If anyone wants to come on screen throughout today's broadcast, you can copy and paste this link that I'm putting on right now in the comment section. You can paste it into your browser. Show your camera so we can be prepared to bring you on, and you can ask your question quickly and then hopefully get an answer and keep it moving. Okay. All right. Or you're welcome to sit backstage. I know a few people yesterday came, they really didn't want to ask a question, but they just sat backstage. Feel free to do that as well. You're welcome here on the Kim Jacobs Show. So we're going to take our next episode sponsor, which is none other than Silver Shield Security. So Silver Shield Dash Security is a female-owned security company in the state of North Carolina, South Carolina, and in Georgia. Make sure you check them out and let them know the Kim Jacobs Show sent you their way. We'll be right back after this commercial break, Dr. Bailey.
Sounds good.
It's not just another day, it's a brand new day, full of all the fun, love, and laughter you and your family create. Silver Shield Security understands feeling at home means feeling safe and happy. No credit checks, no contracts. We offer payment arrangements, and we'll even give you a free door camera. Find out how we can brighten your day even more at silvershield-security.com. Silver Shield Security.
All right, everyone, and we are back talking with Dr. Ron Bailey. And I would like for us to, at this time, just take a moment. And Mackenzie, if you would, pop some of the comments up. I see you. Portia says, good morning, with lots of sunshine coming her way. Okay. Hashtag B1. I don't know what that means, but glad to have you, Dennis. Lisa Thomas says, good morning. Mary Hook says, good morning. God's morning. Okay, Elaine, glad to have you. Corey Robertson, you're tagging people. Thank you, Portia. Nisi says, good morning as well. Any questions? What is this? What is this? Guru Dev, what this is? We're talking today about COVID's impact on your mental health with Dr. Ron Bailey. Okay, next comment. Let's see. Top of the morning to you, Tremaine. Wow, how did you get that framework? I don't know. Do you know what you're talking about?
Not sure.
Okay. 1 million deaths globally. No, that's not globally. That's just in the United States.
Well, I mean, that's in the U.S., yes.
That's only in the United States, just so you answer that question. All right. Good morning. Speaking with Robin. Hello, Dr. Bailey and Kim. I live in New Orleans as well. A great place to live, Lisa Thomas says. Top of the line towels. Okay, get that. I don't know what that means. Okay. You're ignoring the facts of masks doesn't work and causes more problems, Jeremiah. Let's stop right there for Mackenzie. Give Dr. Bailey a chance to speak to that.
Right. Well, I do think, as I alluded to earlier, there certainly has been a politicalization, I think, of the entire process of health during this 2-year pandemic that I've really not seen much before in my not 30-year career. Very often in healthcare, physicians, based on data, based on what the empirical data argues, the science, make recommendations that people don't enjoy, don't necessarily like. I'm sure everybody don't want to wear a helmet when they wear a motorcycle or drive the speed limit. There's just a myriad of examples. We're regularly telling people what to eat and don't fry your foods and don't overeat and just all kinds of things. Again, I'd argue, I'll make the point, I'm not going to argue, that a person chooses not to do it, in many regards, that can be their choice.
That's right.
But there's a fair amount of antipathy toward those of us who share correct information or who make the point that these are things that are health promoting. That's, I think, in many regards, been a big challenge and substantially different than what I've seen throughout my career. And that's
Yes.
my professional experience.
I love how you are framing. That probably goes back to the other person's question about the framework, because that's what you're doing. I believe you're providing a very fair discussion. You're saying a person can choose to do just like wearing the helmet, or they don't have to. It's their choice, because life is full of choices. But you're just speaking from your own personal experience and as a medical professional, what you would advise people to do, even at this phase. I love it. Okay, keep going to the next comment. Are you okay answering these comments or questions that's popping in?
Oh, absolutely. I would also just argue, I think that physicians should also be fair and honest with patients in our society. It's a bit disingenuous to me as a physician, not when lay people have these concerns or what have you, because lay people don't spend their whole life learning about it. But when physicians make the argument that you either shouldn't wear the mask or you shouldn't be safe, the reality is, in our own surveys of physicians are the single group in the world most likely to wear a mask, most likely to engage in all of the safety maneuvers. So we should be promoting a positive message of safety, qualified health, and encouraging persons to be educated and aware of what those concerns are, not argue about whether they're educated or not. I think another issue is that it's also true that some communities have historically not had the advent of the opportunity to receive the best care. There may have been a time in our life, not in our lives, but in our country, where if masks were available, we knew masks could be helpful. Some groups had access to masks and others did not. Maybe because of poverty or because of a location, let alone if because of a race or ethnicity. I'm happy that now in 2022, when the government says that these are safety promoting measures, every human being can actually get access to the vaccine for free, and mask, and the treatment. I have a relative who took the Pavlovid, which is the treatment we give you now if you get COVID, and it's free to every American in the country. So my country has grown and is doing some things better in the healthcare arena. That's a message that Americans should be aware of.
That's very good. So right now, according to everybody, can get a vaccine for free. Is what I'm hearing.
You get the vaccine, and you should be boosted. Somebody mentioned that in your list. But if you actually contract COVID-19, there's a medicine for treatment now called Pavlovid, and it actually is also available at every pharmacy in the country, or when it's available, at no cost.
Okay. Wow. Okay. Good morning from Michigan, Linda said. Anybody else? Excellent. Excellent. Have you heard of Guillain-Barré with the vaccine? I was paralyzed from that booster and could have died. I'm kind of anti-COVID vax now. Oh, this is actually Mackenzie backstage is saying this. She's on my team staff. And at 20, I don't know exactly, I think she's 21 years old. She got her second booster shot and had some type of adverse reaction that led her to have Guillain-Barré, and literally she could not walk or anything. She had to go through rehab. She's coming on the show also to share her story, and I'm grateful that she's going to be doing that. But her life turned upside down. She has a toddler, missed his first steps. A lot of things happen. Any things that you have in thoughts to this?
Well, I'd say four things briefly. One, first and foremost, been in medicine for my entire professional career. Whenever anything adverse happens to any person, the illness itself or a side effect of medication or treatment, of course, our heart goes out to that person. Of course, we wish that would not happen. And my heart goes out to her, and I hope she's better now and can move forward without any health complications. Secondly, I would say that I've never prescribed the medication in my life, and no physician has, or done a surgery or provided a care or treatment where there's zero risk. There are risks and there are side effects, and that's an unfortunate reality of all the treatments that exist. Early in my career, folks wanted to use, St. George wort, or things that they thought did not come from, pharmaceutical companies. And now we know that you get side effects with so-called, supplements or other kind of agents as well. So the reality is we do the best we can in healthcare. It's a growing incremental process. That's why we receive information based on what we've done previously to go forward. And I think that's what needs to happen. And I think a very academically oriented, progressive fashion. The third thing I simply argue, though, is that one thing that's key is if somebody does have a problem, and I have heard of Guillain-Barré, then we get that message out very quickly. We go and recheck our steps and double check our efforts. And that's why many of the treatments we provide, something that people think is safe like penicillin, has grown over the years, and we've made them better. So there's no guarantee that because something exists, that it's going to exist in exactly that form or fashion forever. It's, of course, our responsibility to limit risk and enhance better overall outcomes for persons. My fourth and final point simply is, as long as we're promoting a pro-education message and getting the argument out that persons should do the things that they should be safe with, I think that's key. If someone does have the difficulty, then it's our responsibility in healthcare to respond in a way that provides her a good overall treatment so that she can live the quality of life that she deserves.
That's really great. Thank you so much for that empathetic answer. I really appreciate it. Any other comments coming in? We're just going to take maybe about 2 or 3 more right now and then go to the next point that we want to talk about for today. Any others that we need to put up? Good morning from Washington, D.C. Glad to have you here today. Hello from South Africa. DSTV, it's a pleasure to have you. Yes, he is. I had COVID in March of 2020 when there was very little known about it, but God took me through it, and now I know people who recently have had the virus. Wow. Okay. Any other comments? Okay. All right. So what we're going to do at this point then is we're going to take just another commercial break, and when we come back, Dr. Bailey, what I'd like for us to talk about is how COVID and the pandemic has affected the mental health of individuals, but even more on Black men too. I would love us to talk about that because that's what I know you're here to talk about, is how African-American men's mental health is impacted. But believe it or not, pandemic has impacted every person's mental health, because this is something sincerely that does not have a respecter of person. It does not matter what your color, nationality, your spiritual belief. COVID has taken so many people's lives and have left people grieving at a whole unimaginable level. So when we come back, I would love for us to talk about how it has impacted the mental health of everyone, if
Certainly.
possible. And we're gonna talk more with Dr. Bailey right after we hear about Attorney Charles Everidge with Hunter Everidge Law Firm, and that's hunter-everidge.com. If you're dealing with disability, wrongful death of a loved one, or you're dealing with like personal injury of any sort, reach out to them. They have an office in Montgomery, Alabama now, as well as in North Carolina and in Richmond, Virginia. So make sure you take a moment to reach out to them. We'll be right back after this break.
When someone has lost a loved one, they want to know what exactly happened. They want to know, is the other person going to be held responsible? And they want closure. At Hunter & Everidge, we help clients that have lost a loved one move on, and to do that with dignity and respect that they deserve.
All right, and we are actually back. We are back talking with Dr. Bailey, and I see that you backstage, Mackenzie, would like to just pop on and ask a quick question. Is that okay with you, Dr. Bailey, for a quick second before we transition?
Certainly.
All right, go ahead, Mackenzie, come on.
Hi.
Hi.
As she said, I was paralyzed from the COVID booster, and I just wanted to know, how can you stand behind something like so strong that has had all the negative side effects it's had? Like, not even with Guillain-Barré, but with like chest issues or nerve endings or whatever, because I had no previous health conditions at all. I mean, I'm anemic, but that's the only thing. And I got the first two when I was nursing my newborn at the time, just because I wanted him to have the antibodies. And then they came out with the first booster, and it was like 8 months later, so I got it. And then about in February was when I had to go to the hospital and get admitted and everything, and go to physical therapy and all that stuff. I just wanted to know how you can kind of stand behind something that has had all those issues, if that makes sense.
Well, there's really three considerations, and I think I said one earlier, so really four. First and foremost, I'm seeing you now, so again, I'd share, my heart goes out to you. No one wants adversity to occur to anybody, so I think I've said that, and I'll share it again. But I share with you how science works. 1 million folks may get a surgery in the United States today. 1 in 10,000, I hate to say it, but I'm being very real on your show today. It's a real relatable show. 1 in 10,000 die from the anesthesia. But people don't talk about that pretty regularly, because most know the 99,000 that didn't die from anesthesia, and they had a surgery, the gallbladder taken out, they're going on with a good life. If we did no surgeries at all on all 10,000, they'd had all kinds of healthcare problems. That's probably why healthcare has grown over the years. Why in 1900 the average American lived to age 49. By year 2000, average American lives to age 75. So we improved their life because there have been surgeries and healthcare and what have you. So the reason you can stand behind it is I'm speaking from a global systemic perspective of what this vaccine has been able to do for 100 million people, or 60 million, what the case may be. But again, I'll acknowledge my third point. Any one individual certainly can have an adversity. Now, what we do is my fourth and final point, we're responsible in science for addressing what's called the risk-benefit ratio. If the risk become higher for a large number of people by having it, then the benefit, then of course you would pull it from the market. And at times you've seen medicines or treatments pulled from the market. Every surgery that's done now has not always been done. Some started earlier, then they stopped doing them for one reason or the other. So we're regularly in the process of reassessing ourselves. We should in organized healthcare, because we want to make sure we're providing the best overall product. I hope that makes sense. I do think that if a person is focusing on, if they've had a bad experience on their own, of course they're not going to be pleased with that item. But when you ask me why do I think the vaccine is good, is I'm looking at large numbers over a long period of time.
Right. Do you think children under 5 should get the vaccine? Because they just made it where.
Absolutely. I have a 2-year-old grandson. At age 58, I don't have any young kids. And I have pushed my daughter and my son-in-law to get them the vaccine. I think the vaccine is safe for children. I've read the data. One it took longer for it to become available for children than adults is that our country, our government was much more aware of the need to ensure we had better testing, more people involved, longer periods of time. So I'm comfortable that it's safe. But I love your point. If you're really asking me, Ron Bailey, do you think there's a possibility that any single child ever, if 10 million get the vaccine under age 5, that any one of them may have a bad outcome? Absolutely, that's the case. Ron Bailey, do you think that it's possible that your grandson, Jeremy Mason, might be that one? That's possible too. But is a possibility more important for him to get it than to be maybe the 99 million, or the number maybe or whatever, that may actually get the COVID-19? Absolutely. And that's, I think, theoretically the process of medicine. But you make a great point, I think, McKenzie, and I think if you give me a chance to kind of talk about it, because I think that what we got away from in our country for the last few years around the world is this level of a conversation. And this conversation, I think, is what's most accurate for people who are trying to figure out what are the relative risks. And the risks are better if you get the vaccine, even if you're under age 5, than if you don't get it. That's why I got it. My family all received it. My 2-year-old grandson's going to receive it, because I think that overall we're better off with it than without it.
Well, everyone in my family got it too until I had my adverse reaction. When they first came out with the 5 to 12-year-old vaccine, my stepsister, she's 9, she got it. And at that point, I was like, well, when they come out with a booster for 6 months to 5-year-olds, I was going to let my 16-month-old get it. And with the reaction I had, we're just hesitant on it. So, yeah.
Well, if I can, I make one other point, and I don't mean to be over reductionistic. Again, I think that your comments are so timely because so many Americans are bringing this level of consideration and concern to the vaccine, and rightly so. But let me try to give you what I should to my patients in my own office. I'm being very honest and earnest with you. I had a patient in my office yesterday. We got talking about this. Somebody's going to die in a car wreck today. Every American is not going to stop driving their car for the rest of their life.
Right.
Somebody's going to have a few days ago, unfortunately, a bad problem in Buffalo. But we aren't all going to never go to the grocery store again. Now, if the Buffalo situation happened at 1,000 grocery stores or whatever, people may stop going for it if what's going on with that. Or if every third car in your city wrecked and stopped and killed, it'd be different. But probably the risk-benefit ratio occurs because for many people, the number of the adversities are remarkably small compared to the number of persons who are getting some benefit by driving a car or going to the grocery store or getting a vaccine. That, I hope, for your audience, Ms. Jacobs, may be a reasonable way to kind of think through where we are with the relative degree of risk. The final point I would love to say, if I can, is just that I think that what people should get, though, is accurate information. One of the talking points I received today is what do I think about misinformation, and that's, I think, what's really bad. When persons are getting the story accurately and correctly, that, I think, shows like Ms. Jacobs' show give us a chance to get correct information out, I think, to large numbers of Americans.
Wow. I think that you couldn't have answered it any better. And I thank you so much, Mackenzie, for popping on to ask your question. And I will put you backstage now and have you go back to work. Thank you. I appreciate it, though. And it is very good questions because I think she speaks on behalf of quite a few people that would be viewing today's episode as well. So, all right. Let's go back. Let me put me back over here. I'm used to being, you know how you used to being where you used to being? It's like, hello.
Right. And if I could add, I mean, I think Mackenzie's point is remarkably timely. If we move away from the issue recently, Ms. Jacobs, of the COVID vaccine, most Americans should be aware, if they're not, of the struggle we've had in American medicine for a decade or two about vaccines directly causing autism. So if persons thought that the vaccines cause autism, they may not get a vaccine for, measles, mumps, or rubella, or things that I think we thought we had almost eradicated years ago by vaccinating large amounts of the American population. So these issues are real, they are pertinent, and they are so essential that persons in all settings, but definitely those in science like myself, must get the message out. We're going to hurt ourselves and our country and our young people much more if there's an excessive fear of vaccinations or treatments that is unwarranted because of a misunderstanding that any one singular side effect overwhelms all possible benefit. I think that's really the discussion that we have to have with our society.
Yeah, someone said that these are apples and oranges. Let individuals have their own choices, Francis said. And someone said also, Terista, what is the percentage of kids having COVID and seriously being ill? Has COVID had serious reactions on kids? That's a question someone asked.
I'm not aware that, and of course, serious is a relative term, but I'm certainly not aware that I mentioned the risk benefit ratio earlier, will be such that on kids, not sure if she means the children less than age 5, or if she means,
Probably.
persons, 5 to 15 or whatever, 5 to 12, excuse me, if they're at much more substantial risk. I would argue that what we should ask for of our government and our academic leaders is that we do the research that's warranted. We use standard protocol and do it in a correct way. We do it with a large number of people. We call it a large N. So by the time we make a decision, is based on studying 1,000 people or 10,000 people, not simply making a decision based on what happened to one person, what they call an N-01, if you will. And I think that's the issue, that those of us in science must be more effective at getting a message out, hopefully in a way that's believable and that people will trust.
Okay, well, you've done just a very a beautiful job of being graceful and answering all of the questions on the spot like this. So thank you. We're going to take another commercial break. This time, when we come back, we really are going to talk about the impact that COVID has had on mental health and
mental health. Okay.
Okay. All right, everybody. We're going to take this. Not this time, Mackenzie. I'm going to take Les Brown as the episode sponsor. Les Brown right now.
We make decisions, and our decisions make us. You have something special. You've got greatness in you. When I look at this picture with my brother and I, born in an abandoned building on a floor in a poor section of Miami, Florida called Liberty City, and I was labeled educable mental retarded. They called me DT, the dumb twin. No one could have told me, by investing in myself and learning how to communicate, how to present myself, how to speak to one-on-one or small groups or large audiences, that it would dramatically change my life. I'm 77 now, and I'm looking for people who are serious about becoming successful, about becoming a category king, on how to tell their story about themselves or about their business, or how to monetize their dreams and make a difference on the planet. If that's you, I want you to reach out to me. I'm gonna teach you how to tell your story, how to use quotes, how to use humor, how to make people laugh and feel good and cry in their tears. Oh, let me tell you something up in here. People say we have the best training program on the planet and train more successful people than anybody on the planet. And you can be the next one. This is your time. This is your moment to turn adversity to your advantage. But you gotta be hungry. You have something special. You got greatness in you. That's my story, and I'm sticking to it. Bye for now.
All right, everyone. And that's the legendary Les Brown himself. And so we encourage you to visit lesbrown.com to learn how you can sign up for the speaker training program. And let me make sure I put that up there again, lesbrown.com. There is a speaker training academy there that you can register for, and you can do that today. And if you do get the opportunity to let anyone know, let them know the Kim Jacobs Show sent you their way. All right, Dr. Bailey, talk to us about COVID's impact on our mental health.
Absolutely. I think that there are 3 or 4 key issues, I think, for you all to be mindful of. One, first and foremost, I think that when there are stressors, disasters, conflicts, it puts our mental health at a great deal of risk. I give a lecture. I'm in New Orleans now, but I give a lecture on how there's been more violence after disasters, after Hurricane Katrina and after hurricanes and earthquakes or whatever, because people become more impulsive and more irritable, have a harder time using their normal defense strategies to find a better way going forward. Right. I can say that what this pandemic has done in addition, is it's lasted a long period of time. I think we probably all have a 4 to 6 month window to kind of manage items, and we expect it to kind of go away and for us to kind of get on top of it. So I think that part, people have become fairly numb to some of the considerations because it's gone on so long, probably
Yeah.
longer than our normal emotional makeup would allow us to tolerate it, right or wrong. It's just, I
Right.
think it's just a fact. And I think it's also been difficult because it's been a fairly intermittent and episodic. It comes and goes. It did just kind of come really bad. We got a treatment and it all went away. We opened and we closed. We opened and we closed. All those issues, I think, collectively are adverse to our mental health. They create a greater risk of clinical depression, the primary affective illness. About 1 in 20 people, 5%, meet criteria for major depression at some point in their adult life. But they also enhance the risk of anxiety, which can be a bit less severe, but more common, but problematic. It may start off with insomnia and a little trouble with restlessness, irritability. 1 in 6 people may struggle with at some point in their adult life. And that may be a mild problem for some, but can worsen, cause trouble in relationship and on your job and conflicts with law enforcement or other authorities, if you will. So I definitely think that there are a variety of variables about the pandemic that have worsened the likelihood of normative mental health that we should be mindful of.
That's interesting. Okay. And you and people that have all of these family members that have passed away and friends, we can all name people. Just 2 years ago, none of us even knew about this disease that came out of nowhere. And maybe I'm just thinking it came out of nowhere. Maybe it didn't just come out of nowhere. So is that a myth that it came out of nowhere? Let's just address
Well,
that.
they call it COVID-19 because there's been more than one before.
Right.
Normally we have so-called common cold, rhinoviruses or whatever, or typical ones, and we get accustomed to them. They come, you get a runny nose, you keep on with your life, and you move forward. The COVID got more people's attention, and then there's a lot of, I think, propaganda. I tend to think a lot more of it was unfortunate in the impact it had on people. Avoided whether it was true or not. Obviously, it was unfortunate because it had many people wondering whether it came from a different country, whether there was some nefarious activities involved that allowed it to continue, whether they're being used as guinea pigs and things tried on them. All issues that I don't necessarily believe, but when people talk about it a fair amount, you recognize that because of various access to media, many call it social media, there's a lot of information that people have access to that very often is not what we call peer reviewed. It didn't go under the review of other professionals to determine whether or not it had some accuracy or not. I think that's been unfortunate, and that has worsened the likelihood of more mental health problems, most importantly, the higher risk of clinical depression in individuals in our community.
So what can we all do as a society? Like all of us need to take some level of accountability and onus and what we can do to make things better for our fellow neighbors. So what can we do from your perspective to just help people mentally and what everyone's going through during this time?
Great point. Great question. And I think there's a lot we can do. And I think that's one reason shows like yours are so valuable, because people should walk out with recommendations to move forward and have a better day. First and foremost, I think education matters. I've talked a lot today about the fact that people should have access to information from multiple sources. I think one of the struggles in America now, many get the information all from one source or a single source, and it may be slanted on one side or the other. I myself try to listen to information from a variety of sources, some professional and some lay people. Of the lay groups, I mean, some tend to, they argue, be more right or more left, as the case may be. I try to listen to a majority of it and try not to take any of it at face value as factual and as truthful. The reality is we should be skeptical about much of what we read, but then of course the skepticism shouldn't become such that you don't believe any of it. It just should be dealt with in a context, I think, of an academic quality. Those are my thoughts. In addition, I think we have to provide better relationship support for people, whether that's with family and friends, that's with your colleagues, your own kids or neighbors or what have you. The pandemic has caused many people to kind of close their door because many were trying to avoid being within 6 feet of others, and we lost a lot of that. I think that the biggest issue I've appreciated is how many people lost the ability to go to church, whether it was on Friday or Saturday or Sunday, or synagogue or mosque, and to get the communal benefit by being around others who are like them and who worship similarly and have a lot of commonality and social engagement very well. We do a piece here about how if you have social isolation, it actually changes aspects of the brain. Parts of the brain that are functioning normally begun to change in size and shape of morphology and not function quite the same. So being socially isolated is a bad thing. We should find ways within reason and safely to to re-engage in those social settings that are very, very important. My own mother, for example, is involved in a sorority, and I think she's missed going to a sorority meeting for a year or two. And that's been, in addition to church, one of the biggest, most important aspects of her life. She looks forward to those 2 hours a month when she's around people who went in her same sorority, and others have different kind of groups that they're involved in. I encourage that and do it in a safe way. My final point, I think that if persons didn't lose trust in authority, they may unfortunately lose trust in us as doctors and professionals. I'm a psychiatrist, and we've known for some time that one of the unfortunate data points in psychiatry is we are the area of medicine most likely to have a person come to you for an appointment, see you for a visit, get a recommendation from you, and never ever get the medicine filled the first time, which to me argues against the issue of stigma, argues against the issue of trust in historical institutions, physicians, and healthcare, and argues that there's so much information coming at people, much of it, I think, misinformation. It may cause them not to do the kind of things that may have helped them in their own health, including their mental health. Three key issues for me, I think, that I think your audience should be mindful of.
That's really good. I thought you were going to say some more. I'm like over here, like I'm at a movie. I'm like, wait, what? It's like then you left me on a cliffhanger. You like another cliffhanger on me. I'm like, wait. This is some good stuff.
There's a lot to say, but I think that your show is a very effective one. Give people a chance to share their thoughts. I love the fact that people will challenge experts like myself or you and what their thoughts are. At least we're talking. What shouldn't happen is we shouldn't all run our respective corners, ignore one another, and only listen to one source of data. If somebody wants to come to me and share with me, why they disagree, I think that's a very, very good thing. We should be civil about it. We should let each other talk back and forth, and we should allow the data to. And I went to Morehouse College, so I got to put that in Atlanta, Georgia. And one thing I think professors taught there was, a good Morehouse guy should be somebody who could defend his own argument and with a strength of conviction with your position. And I think you have to read and be mindful and aware to do so. And that's what I'm trying to do in healthcare. And I think that is something that our society benefits from.
Wow, that's some good information. And I see you all the way from Australia, Alan. And someone else, Dennis, says some people get caught destroying property and got fines. What about those who put out the pandemic in an unprofessional way? It's not rocket science. They know that or something. So good point. I think you're sharing your perspective. Good. Any thoughts on that, Dr. Bailey?
Well, again, I think that there are a lot of considerations. I think there's been a fair amount of discussion about this issue. I think that on the mental health piece, I've often made the argument that persons are speaking, I think professionally at least, about mental health and psychiatry. More of us in psychiatry should be doing a lot more than talking. We should get out and have our messages heard. We should, as I said earlier, be willing to defend an argument with science and with data and with empirical facts. We should appreciate that if people are saying it, it matters to them and it's important. It should be important to us.
That's
so
right.
I want to hear what your readers and what my patients and what my neighbors and friends argue if those arguments are different than what I'm reading. Because one issue that I may be reading some things very different than them. I'm at 6 o'clock every morning reading generally a couple hours of medical journals. Often I'm talking to people who didn't spend 2 hours that morning, let alone 2 hours most of the last 30 years reading medical journals. So it is likely we're going to see things differently, but it's not their fault. It's my responsibility to, I love your point, be real, be relevant, and be relatable. I love that part about your show because the reality is if I can't do that, that's Ron Bailey's fault. I've got to be able to put it into a package that makes sense to people and make them at least say, let me listen to this and think about what this guy is saying.
Okay, very good. Somebody says it's imperative to handle the pandemic very carefully and not with mass hysteria, which I think that if you go out and do a national speaking tour, you bring that level of calm to the situation because you're simply sharing as many facts as possible. Right. So I appreciate that and you being my guest today as well.
Thanks.
Let me also ask you, this is just an aside, I needed to know, how did you even become interested in being in this field of interest?
In psychiatry?
Yes.
Well, good point. I'm from Beaumont, Texas. I like to kind of squeeze that little piece in or what have you. And I think so I love your question. I think that men very often had a lot of psychiatric and psychological problems that went unrecognized or diagnosed. I tell people that the best psychiatrist I've ever known is my father. His real day job was he was a school teacher, coach, and he loved it all. But for about every other Saturday morning of my life until I went to college, we went to the barbershop, and I heard him wax eloquent on every potential psychiatric issue of the day. So I clearly believe that Black men, like all other people, do get psychiatry. They just don't get it in a formal kind of way. That made it interesting me in going to psychiatry.
Okay. Awesome. That's a good inspirational point. And then I also wanted to give you the chance to just say anything about some of these myths that are out here, myths and miseducation and misinformation when it comes to COVID and the impact that it's had on things. So somebody, Mackenzie said he's had or her son, her toddler has had all of his shots at all of his appointments and his checkups. She was just hesitant about getting COVID vaccine for him.
What I say about myths is that's most unfortunate to me is they've become a process that allows some individuals who may not have good intentions to have easier access to hurt and harm large numbers of people. Think about it. If you really wanted to harm a community, what better thing to do than to go on social media where you can't really, nobody knows who you are. You know, you don't have to kind of stand tall. You see my face, you see my name. Often you read on social media, you know who who's talking to you.
Right.
You give misinformation, something that's wrong, make them not get a vaccine, or as I said before, don't wear your helmet, or don't believe in your political systems, or don't believe in voting, or don't drive your car, whatever the case may be. And if a large number of people will change their behavior because something that they heard or read from somebody who they don't know, and they can't question and they can't pin down on the facts behind why the person said that, we've really changed much of our society and how easy it is to harm large numbers of people. Some would argue, I should have mentioned voting, but I did, that some other countries, I'll just say it that way, were involved in adverse affecting the American voting system earlier. And I'm not sure that I'd ever thought in my life that could actually happen. We thought that we had a closed system. We don't. Because of access to media, not just social, but all kind of media, many individuals and groups from all over the world can have access. So it requires each person to be much more vigilant and diligent in screening information that they receive, I think, before deciding that it's something that's going to change their behavior, especially if it's in a negative way, if that may put them at risk.
That's good. Okay. Wow. This is a great discussion that you're sharing. And as far as, I know there were some stats that you had put back here for me, Mackenzie. I want to make sure I grab those as far as toddlers, because other people had the question as well. Somebody said, go ahead and put that point up, Mackenzie. Good point regarding churches. Why was God's house closed? Due to those who believed. Now he's part of the sea. He fed the many with a few loaves of bread, yet his house was closed. Who is kidding who? Okay, Bobby, that's a interesting way of thinking of it. So, and everyone has their opinion and their thoughts. I can't speak for every church. I can only say that I think that pastors and church leaders are also human beings as well. And so whatever the laws of the lands are, we should probably be doing everything we can to abide by them. And but I can't really address that particularly. If you have any thoughts, Dr. Bailey, feel free as well.
No, I think that, I thought what you said was correct. Pastors and ministers are people too. There's been a lot of attempts to provide safety, and some did it in different ways. So I think your answer would be similar to mine.
Yeah, and I know in different churches that I've attended myself, I commend some of the pastors that I've seen. They've gone to the extreme to provide safety checks and checking temperatures when you walk in, providing masks for those that don't have masks, giving where you can't sit in certain seats, but you can put a certain amount of distance, and they roped off certain chairs. So I've seen some pretty extreme things happening in churches as well. But I think your point is, why are you people closing the churches if you're supposed to be able to go to the house of God for those that believe? And I don't know the answer to that. So, okay. All right. Go ahead. Go to the next thing, Mackenzie. All right. So I don't see. It's sad. Where's the faith? The faith that each person, I think, has their own thing that they have to hang their souls on. I know I hang my soul on what I believe, which is I believe in my Lord and Savior, Jesus Christ. So that's personally, that's not the Kim Jacobs Show. That's me personally. And each person has the right to believe whatever they choose to believe. And I have no condemnation for what anybody else believes. Okay. All right. COVID-19 vaccines for babies and children aged 6 months and older are finally here. The CDC approved Pfizer's pediatric vaccine for ages 5 to 11 on November 2nd, 2021. And this came from verywellfamily.com. There are a lot of other stats here as well, but I don't want to spend too much more time on the stats. We have about 3 minutes left, and I want to give you the opportunity, Dr. Bailey, to have your closing comments.
Well, thank you. And my closing comments would simply be to again thank you, Ms. Jacobs, for having me on. I think I've said earlier, and I'll repeat that I think shows like yours do our service, our community, a solid, as my son would say. They do us justice, because the reality is we have to be talking about these issues to get messages out that are pertinent, relatable, and important, I think, to our community. I also think that this issue of trust comes into play. People build trust, I think, with continuity, with consistency. If you're trying to bring people on your show that I think are sharing these messages, I think that are pro-health promoting, I think that should be key. I think also these should be about honesty. Some of these comments are not always easy to hear. I made the comment to the young lady earlier that 1 in 10,000 people who have surgery can die from anesthesia. A lot of folks don't know that. And you get that little form before you had a surgery, you put it in front of you, you half asleep, you sign it real fast, but all you think about is my gallbladder, and I want my broken foot to be better tomorrow, and like the case may be. But the reality is there's so many risks in what we do in healthcare that it probably is easy to overlook it. And this is just one setting with this pandemic where so much has come out about the risk. The discussion, I think, has been out of balance, as if we begin to forget in other areas as well that the benefits should always outweigh the risk that we engaged in. But unfortunately, there are some risks, although we hope they'll be minimal. And I think that's really the message for physicians. And I thank you for allowing me to share it. I thank my group that I'm with here, the Cobb Institute. Our entire activity has been to promote an understanding about healthcare disparities and work to minimize them or limit them. We have the All About Us program and We Can Do This program, huge programs geared to get the message out, to be honest and fair, particularly to address communities that have historically, I think, been underrepresented and not heard from because of poverty or lack of access to care or not having the right Medicaid card. Half the states didn't do Medicaid expansion. I wrote a book about that years ago, thought that they would all take the Obamacare money, half did, half didn't. So it's a huge fight in our country about education and healthcare, two huge premiums that people need to have a decent life. Those are things that we, I think, should be promoting, and we intend to do so going forward. So the CARB and the National Medical Association will stand strongly with groups like yours trying to get accurate messages out.
That's excellent. And any of your contemporaries that would like to grace the stage of the Kim Jacobs Show with us now, we're obviously streaming live now on Dr. Les Brown's platform as well. We welcome you with an open invitation to be able to spread the message to people around the globe. So this is a global program where people are getting a chance to hear your message and take it back to their respective areas. And yes, I do agree that Dr. Bailey is a superhero. And so I'm grateful. Big ups to all of the essential workers that are out here as well. And so, yes, to any of you all that are on the front line working to help treat patients that have COVID, that are holding the hands of those that are transitioning from this earth, you all are superheroes, and we appreciate you. Now, how can people stay connected with you?
All right, well, my website is www.baileypsych.com, BAILEYPSYCH. They can also reach me if they are interested in more direct discussion at 281-614-9515.
Okay, and I see I'm seeing Les Brown is saying he sent me a message. So let me see before I disconnect if something that he was trying to say on the platform. Make sure you all stay connected with Dr. Bailey at BaileyPsych.com. BaileyPsych.com. Hold 1 second. Just make another point, Dr. Bailey.
Right. Well, I was going to simply again add that I think groups like the National Medical Association, our goal has to be to address issues of health disparities. These disparities have existed the entire 100+ years of our organization, and they're real. Individuals, Black women, for example, have more deaths during childbirth than people of like circumstances who are not African American. Black men, more prostate cancer. Those are all issues that I think are relevant, more lung cancer as well in those groups. So we have to, I think, do a deep dive and really think about and work effectively to understand what some of the parameters are. Many call those the social determinants of health. There's a pretty prominent guy in Moore School of Medicine now named Damon Dawes who calls it the political determinants of health. All these other variables that lead to bad outcomes in healthcare. Our job as doctors have to be to improve quality healthcare and decrease morbidity or disease and mortality in the lives of all people, including African American men.
All right. Yes. So I appreciate everything that you've shared. Dr. Les Brown's talking about something that he needed me to do. So he's like, okay, I sent you a message. I was like, oh, I thought it was something pertaining to what's happening on the episode today. So this has been extremely informative. And overall, we are in control of some of the things that we allow to affect our mental health. Is that what I'm kind of walking away with, Dr. Bailey?
I'd agree.
Okay. All right. Listen, this has been an incredible episode. You all can stay connected with Dr. Bailey at baileypsych.com, baileypsych.com. And please make sure you tune in tomorrow at 11 o'clock a.m. Eastern Standard. We have our Freestyle Friday episodes. And guess who will be on? Jay Nolan, the author of this book right here, The Science of Getting Rich. So you want to be in your virtual seats to learn more about the science to getting rich. And Jay Nolan is the author. He'll be right here on the Kim Jacobs Show tomorrow at 11 o'clock a.m. along with our Freestyle Friday experts. So we'll see you then. And Dr. Bailey, you have been just a blessing to our platform. You're welcome back anytime.
Thanks. I really enjoyed it. Great show.
All right, everybody. You all have a fantastic day. Thank you, Mackenzie Backstage. And you can go ahead and close us out. We'll see you tomorrow at 11 a.m.
Take care. Have a good day.
Hello, everyone. I'm Kim Jacobs, host of the Kim Jacobs Show, where we're bringing balance to the world one household at a time. Listen, we go live every weekday, Monday through Friday at 11 o'clock a.m. Eastern Standard Time. I bring guests on that talk about their backstories, things that they've had to overcome to become who they are today. Many of them are balancing and juggling life, and they've become experts in different fields. So they're sharing tips with you to make your life just a little bit easier. Many times as a guest in the studio audience, you'll get a chance to walk away with a missing piece of the puzzle that might be missing in your life. Let's go on this journey together, and I look forward to seeing you Monday through Friday at 11 o'clock a.m. Eastern Standard Time, right here on the Kim Jacobs Show.